How do you retain patients when buying a dental practice? Do you have any idea what the average patient attrition rate is when buying a dental practice? It's lower than you think. Buyers are very understandably nervous about patient attrition and patient retention when buying a dental practice. After all, what are you really buying in a dental practice? It's not the equipment, although that has a little value. You're buying the habits of the patients who have been coming to this practice for years. You're buying the patients. I hope you know what I mean. I have surveyed dozens, maybe even hundreds of past clients that I've worked with on their patient attrition numbers. I've asked them 3 months, 6 months, 12 months and beyond what the average patient attrition rate is after they buy the dental practice. Now, this isn't a peer-reviewed scientific study, but I've got hundreds of data points that tell me buyers have less to be nervous about than you fear. The average patient attrition rate for most dental practices is actually a negative number. Let me say that differently. What I mean is the average buyer adds more new patients to a practice after they buy than they lose. And if you think about that logically, it makes sense. Yes, there are always a handful of very vocal patients who are very, very loyal to the seller for whatever reason. It's usually 4 to 12 patients. And they make a big stink, and you as the buyer, you feel bad. It's a hit to your ego. For those 4 to 12 patients, they go away. You as the buyer are more energetic, you're more motivated, you're more interested in the business side of running the practice than the seller probably was. The staff is feeling that. There's energy, maybe there's a new website, there's new initiatives and things that you're doing that have the staff excited and patients get excited as well. The net result is patient attrition tends not to be a problem in most dental practice acquisitions. So what can you as a buyer do to ensure that that fact is true for you as well? The number one thing that you can do as a buyer is retain the staff, something I've talked about in a different video. Maintaining those staff relationships is key to keeping patients happy and feeling like there's continuity between the seller and the buyer. Beyond keeping the staff happy, what can you do as a buyer? The next most important thing is to make sure that there's a good clinical fit between you and the seller. You want to make sure that you and the seller have at least a similar philosophy in treatment styles. I, as a patient, don't want to show up to a practice where I've been told for 3, 4, 5 years that we're going to watch and wait on a few potential cavities, and then have you as the buyer come in and tell me that I need 6 crowns today. The whiplash from buyer and seller can be disconcerting for patients who then start looking around thinking, I don't know about this new guy. Those upfront conversations that you have with the seller around clinical fit, style, treatment philosophy, those are key. Make sure that you're at least close enough with the seller to feel comfortable. The next most important thing you can do as the buyer to ensure the patients are comfortable and continue working with you as the dentist is to avoid making huge changes that the patients see. And by changes, I mean negative changes, things that the patients won't necessarily be happy with. We're talking about things like hours, days you're open, insurances you do or don't accept, favorite hygienists that they love to work with forever. Major changes that a patient might be uncomfortable with, you want to wait and see. Maybe you wait 1 or 2 recall cycles before you make a big change to the schedule, when you're open, or whether or not that hygienist is a good fit for the office. There are no hard and fast rules here. You have to be careful as a buyer to balance your needs as the owner versus the needs of the patient, but keep the patient's needs in mind as well and in what they're comfortable with and what they've been coming to the office. Other changes like fresh paint in the office, brand new equipment, a new chair that actually works. These are the types of positive changes that patients are going to be happy about. Me as a patient, if I can't schedule my appointment online with my dentist on the website, I don't know that I'm interested in working with that dentist. But if you're buying a dental practice, it's very unlikely today that you're buying from a practice where I can schedule an appointment right online or pay my bill online like I do with almost every other vendor in the world. If you as a buyer introduce some of those positive changes to the website, to the equipment, to how the staff is compensated, those are the types of changes that filter through and start to be noticed by the patients in a positive way. So I'm not saying that you make no changes, I'm just saying be careful about the changes you do make. Finally, and frankly least importantly, but still meaningful and impactful, consider ingratiating yourself as a member of the community. Join some of the boards, donate to the Little League team, find ways to get involved as a dentist in this community. One of the best ways to find out how exactly you can get involved is to find out what did the seller do, and find out what other dentists in the area tend to do, and see if you can get involved as well. Is it the local Chamber of Commerce? Is there a big Toastmasters group in the area? Whatever the case may be, if there are opportunities for you to get involved in the community, you'll be seen, known, people will start to create relationships with you. They'll say good things about you in line at the grocery store with their friend who go to the same dentist. That's what you're looking for. Patient retention is understandably a huge deal to you as a buyer. Remember to be less nervous than you're inclined to be. Be very cognizant of how to approach this issue in a way that maximizes your chances of success in seeing all of the patients that the seller of the practice saw before you bought the practice. If you're thoughtful about how you take over the practice, not only will you not see patient attrition, you'll actually add to the patient base in the office in a very short amount of time. I'm very confident of that. If you need to know how best to manage patient attrition in your dental practice acquisition, please reach out. I'm here as a free resource for you. You can go to dentalbuyeradvocates.com where you can find my email, get on my schedule, listen to the free podcast, and get the book for only $2. I'd love to be a resource for you, and this is a hot button issue for a lot of buyers. Reach out anytime.